Hello, welcome back from lunch. My name is Averill, and I'm going to talk to you a little bit today about my journey and findings completing my culminating report during my practicum with BC Healthy Communities. I might also refer to them as BCHC during this presentation. And they are a nonprofit organization that supports communities, local governments, and health authorities to develop healthy communities in British Columbia, and they often do that through facilitation and grants. So I'm kind of lucky that I get to go towards the end of this conference because a lot of you have heard about things that relate to my presentation. So this is the Healthy Built Environments Linkages Toolkit that we heard about earlier this morning, and this is used a lot in BCHC's work. And so as we heard, there's 5 different areas in this toolkit, and one of them is housing, which was the area of focus that I worked on for my research. And it was actually wonderful timing for me to come alongside BC Healthy Communities and do this research because there was such an increased interest in the area of housing from the communities that they work with, as well as across Canada and British Columbia, as I'm sure you've heard in the media. And what the Linkages Toolkit does is connects a lot of public health knowledge and evidence to planning strategies. So that was also what I endeavored to do in my research. And I have to say, I thought that they were the same thing before I started, and they're not, it turns out. So I tried to draw on both public health and planning knowledge to identify key priority areas, gaps, and recommendations in relation to health equity in housing. It's a big area, I'll tell you that to start with. And I thought I would cover it with a systematic review. But I was wrong. That was not the most effective way of doing it. It turned out, actually, when I started my research, that there's very little peer-reviewed academic evidence on this area, particularly in Canada. One scoping review that covered the whole toolkit only found 7 sources in Canada. So I switched over to a scoping review. And what that did is it allowed me to really broaden my inclusion criteria. It allowed me to include gray literature, which provides more real-world evidence of interventions that might not show up in peer-reviewed literature, as well as include literature from outside of Canada, international jurisdictions. And so what I did in the end was I searched 4 databases in total. One was totally dedicated to health, one was totally dedicated to planning, and came up with the number you see at the top there, 126 sources in total. And as I went through my 2 phases of exclusions, you can see in the blue, that's my exclusion criteria, I started to refine my sources. Towards the end, I added in the gray section there, 17 recommended sources. Those would be from courses that I took, from recommendations from my colleagues at BC Healthy Communities, or from professional websites. And in the end, I ended up with 55 sources in total. And they all met specific quality criteria, even though I did really broaden that inclusion criteria. So this Venn diagram, with public health on the left and planning on the right, shows key terms or keywords that were used frequently in the sources that I worked with. And so I found these using the Control-F function. If you don't know that already, especially to the undergrads, it is an invaluable tool when you're doing school. And I sorted the results into an Excel document to see what words were more common in articles or sources from the public health field versus the planning field. And so in public health, they were a lot more focused on health risks, equity, evidence-based practices, whereas in planning, it was a lot more focused on the economic lens and case studies or examples, kind of like that real-world research that I was talking about with gray literature. So that was interesting, but there's actually a lot of overlap, which is great news because we want to be working together. And that is the goal. And so many of the articles that I worked with, in fact, were from a public health lens, and we're trying to apply that knowledge to planning practices. So I was able to organize my findings under the same 4 categories that the Healthy Built Environment Linkages Toolkit used for healthy housing. That would be affordability, underserved populations, quality of housing, zoning. You can see the full descriptions on the sides there. And I will note that I used the term underserved populations. This morning, Michael told us how important language can be, and I believe the original term used was vulnerable. But after great conversations with many of the people in this room, I came to the conclusion that using the term marginalized or underserved better reflected the systemic issues rather than pinning it on individuals. And I will comment as well that you can see the different sizes of those bubbles there represent the number of articles or sources that I found for each area. So zoning was quite small. There's only 3 sources that I found, and that's partially likely in part due to limitations in my research, also need for more research connecting that area to public health knowledge. But I probably could have gotten more results had I used different search terms. All of my search terms, being a public health student, were kind of skewed towards that field. And I was actually surprised that there was still quite a healthy number of sources that connected affordability to health outcomes. And in the end, I made a list of recommendations for each of these areas, which totaled 28 recommendations in all. So this is a model that you might have seen some variation of before. It's called the housing continuum. And what it really shows is the interconnectedness of different types of housing, particularly in relation to affordability. So on the left side of the continuum there, you may or may not be able to see the fine print. That's where we'd see homelessness, and that's where we also have really strong evidence to demonstrate that there's poorer health outcomes and poor health equity. That wasn't new information when I started this, but what was really interesting was that there's actually evidence for poorer health outcomes at every other point along the housing continuum when we have issues of unaffordability and poor quality housing. So what that means is that targeted approaches that we often see to address problems in housing, health equity problems in housing, may not be the best way of dealing with it. I do want to make a note, though, that we need to continue to create space for the voices of people who are underserved, while maybe considering some more upstream approaches. So one way to do that is through this model, which I can't take credit for. This is one of the great learning pieces that I had during my practicum, and this applies the concept of proportionate universalism to the housing continuum. And so what it does is proportionate universalism acknowledges the whole continuum while still recognizing that certain parts in the continuum are more underserved. So what should interventions look like across this continuum if we're considering it as a whole? I created this diagram to illustrate 3 of the key components that we often see in, or that I often found in the definition of healthy housing in my research. So that covers some version of affordability, quantity or accessibility, availability, and then finally quality or safety, free of hazards. And so what we often see is interventions trying to fall somewhere along the side of this triangle. They're choosing one side of this triangle, and they are only going to strike a balance between maybe 2 of those components of healthy housing. But if they're aiming to fall somewhere in the middle, they're more likely to reach a well-balanced healthy housing initiative. And I will mention that when you're looking at this model, it's not a panacea. We still need to consider healthy housing in the context of other healthy built environment components, such as the healthy neighborhoods and active living, transportation that we heard about from some of the other presenters. And so I'm really excited to tell you that my research is already being used in several ways. One of them, I was able to do some knowledge translation and put this information into an action guide, which will be eventually hosted on the Plan H website shown here that BC Healthy Communities has. I have a copy of it I meant to bring up here, but I'm happy to share that with anybody who's interested. And then it's also been shared with a couple of communities that BCHC works with to inform their healthy city strategies or housing needs assessments. And finally, you're welcome to those of you that are in this photograph. I wanted to thank everyone. I know everybody's given their heartfelt, sincerest thank yous, but it's very, very true and can't be said enough how this isn't a solitary journey. And I was so lucky to have two supervisors for this, Jennifer Butcher and Victoria Barr, as well as access to all of the staff at BC Healthy Communities who are so supportive, the faculty here, and my loved ones. So thanks for the opportunities to learn and for your support along the way, particularly while completing this practicum remotely, which was neat. Thank you, guys. I'll leave this one up here, it's more fun.
So there must be some questions. Oh, there we go.
Hi, thanks for your presentation. Could you give an example of a healthy housing initiative that fell in the middle of that triangle, A, B, and C?
Really good question. You know, I don't know if I could say that there's any particular one. I could give you examples of a lot of different types of healthy housing initiatives that are doing a really good job, but in the literature that I worked with and the gray literature that I worked with, that was a new concept. They would start often with a definition of healthy housing, but then there was often not an application of that to the execution of it. And because we're working with different types of knowledge, different professions, there's not a huge examination of that. It's more focused on trying to speak the same language just to start with and having the same goals in those projects. So I'd be more than happy to talk your ear off later about many initiatives that exist that are doing a great job, but I can't really speak to one.
Any other?
I was just wondering, with regards to this continuum in designing healthy housing initiatives, did you come across any type of like timelines of what's the time scale for some of these projects? And obviously, like, you know, emergency shelters for immediate, but did you come across any type of timelines for how long it takes for a city, say Vancouver or Victoria, to move from the market we have now and shift it into healthy housing? What kind of time that would take?
It's a really interesting question, actually, because it's not something, again, that was really overtly discussed. I did also, kind of on the side of my research, examine quite a few strategies. The National Housing Strategy just came out in November, which was really interesting. Give it a read. As well as, you know, Vancouver's housing strategy, Nanaimo has a housing strategy. Surrey just released one last week. They talk about timelines, but they're very political. So they're not always connecting their targets with the steps that are laid out in recommendations. So what is more often seen in the action guides, like the one that I created, is things that we've actually seen recommended in other areas that other presenters have talked about. So starting with partnerships, forming coalitions, however long it takes to do that. So it's more about the steps than the specific timelines. When we talk about timelines, it's more about political timelines. So it would be, you know, partnerships, developing policy, developing planning, and then getting into programs. People really always want to start with the programs. They're so excited to start solving problems, but we can't do that without a strong foundation. Yeah.
Good. Well, thank you very much.